Gastroesophageal reflux disease, GERD, is a chronic digestive disorder that occurs when stomach acid and occasionally, stomach content, flow back into the esophagus. This backflow of stomach acid can irritate the lining of the esophagus, leading to various symptoms and potential complications. Here's an overview of the symptoms, causes, and treatment of GERD. Symptoms. Heartburn, this is the most common symptom of GERD. It's a burning sensation in the chest, often after eating or when lying down. Regurgitation, sour or bitter tasting fluid that backs up into the throat or mouth. Dysphagia, difficulty swallowing or a sensation of food getting stuck in the throat. Chest pain, some people experience chest pain that can mimic heart-related issues, though it's typically not as severe. Chronic cough, GERD can cause irritation of the throat and lead to a persistent cough. Hoarseness or sore throat, stomach acid can irritate the vocal cords and throat, leading to these symptoms. Laryngitis, inflammation of the voice box, larynx, due to acid irritation. Causes. GERD occurs due to a malfunction of the lower esophageal sphincter, a ring-like muscle that normally prevents stomach acid from flowing back into the esophagus. When the LES doesn't close properly or weakens, it allows stomach acid to escape, leading to the symptoms of GERD. Several factors can contribute to the weakening of the LES and the development of GERD, including hiatal hernia, when a portion of the stomach protrudes through the diaphragm into the chest, it can weaken the LES. Diet, consuming acidic, spicy, fatty, or fried foods, as well as caffeine, alcohol, and citrus, can trigger GERD symptoms. Obesity, excess weight can increase abdominal pressure, pushing stomach contents up into the esophagus. Pregnancy, hormonal changes and increased pressure on the stomach during pregnancy can lead to GERD. Smoking weakens the LES and can increase stomach acid production. Certain medications, some drugs, such as NSAIDs, aspirin, and certain muscle relaxers, can contribute to GERD. Treatment. Treatment for GERD involves a combination of lifestyle changes, medication, and, in some cases, surgery. Here are some approaches. Lifestyle changes, elevating the head of the bed, avoiding large meals and trigger foods, losing weight if necessary, and quitting smoking can help reduce symptoms. Dietary modifications, avoiding spicy, fatty, acidic, and fried foods, as well as caffeine and alcohol, can help minimize acid reflux. Medications. Antacids, over-the-counter antacids can provide temporary relief by neutralizing stomach acid. H2 blockers, these medications reduce acid production and provide longer-lasting relief than antacids. Proton pump inhibitors, PPIs are strong acid suppressors that can provide significant relief for many people with GERD. Surgery, in severe cases where lifestyle changes and medications aren't effective, surgical options like fundoplication, wrapping the top of the stomach around the LES, can be considered to improve LES function. It's important to note that chronic untreated GERD can lead to complications such as esophagitis, inflammation of the esophagus lining, Barrett's esophagus, a precancerous condition, and even an increased risk of esophageal cancer. If you suspect you have GERD or are experiencing symptoms, it's advisable to consult a medical professional for proper diagnosis and management.